All right, well, good afternoon. I'm joined here by Marcos Sauri from Consejo. We'll be discussing healthcare careers within the behavioral health field. With that, I'm just going to easily pass it over to Marcos to introduce himself.
Hello, everyone. My name is Marcos Sauri. I am with Consejo Counseling and Referral Services. I am the program supervisor of the substance use disorder treatment here in King County, Seattle, along with another program that I supervise is the Apoyo program. That's for trauma-informed care and system navigation provided to youth and young adults that have been negatively impacted by the criminal justice system. So let me give you guys a little, description of what Consejo is and what Consejo does and what Consejo came from and that sort of thing, right? So Consejo's mission primarily is to provide behavioral health services, substance use treatment, housing, domestic violence, and sexual assault advocacy-based counseling to individuals and families. We use an interdependent treatment model for clients to experience acceptance, emotional security, and developmental growth while learning new skills to establish the quality of their lives. Our service delivery empowers and motivates clients to engage in their communities at their highest level of functioning. So Consejo Counseling and Referral Services came to be an agency, a behavioral health, a community-based nonprofit behavioral health agency. That was over 45 years ago, and this was just a project from a group of students of the School of Social Work out of the University of Washington in the 70s. So the intent of Consejo was initially to assist and provide services for migrant families of Latino descent, work those in travel and in between the states, back and forth seasonal work here and there in Western Washington area. But the need was identified and was such that to be something helpful and of benefit to the community, not just the Latino community, but the community. This philosophy of Consejo has been successful at working with other ethnicities and groups of different cultural backgrounds. So again, my role here in Consejo is the one of a supervisor, administrative, and management, as well as providing services. I'm a licensed clinician. I'm a substance use disorder professional. I do hold a national certification to provide treatment for individuals suffering from substance use disorders, as well as I have a tribal certification to go into reservations and work with Native brothers and sisters as well, whenever needed. So from here, I guess it is good to mention again that Consejo has a number of locations throughout Western Washington. And again, as I mentioned earlier, what was really something put together and intentionally made for the sake of assisted serving and providing services to our Latino population. It was successful to where everybody from all different walks and ethnicities, whatever, are being served now, either in Mason County and Shelton, Tacoma Pierce County, here in Seattle, Bellevue, up north, South King County, etc. So I'll give it back to you. I don't know where you want us to take it from here. I know that we have a couple of things to cover.
Yeah. Thanks for that great introduction to kind of who you are, what Consejo is. I'd love to talk a little bit about, how you discovered Consejo as an organization, as well as how you discovered kind of your current role within Consejo. So almost talking about, your journey thinking from a high schooler's perspective, thinking of, a young man who identifies as Latino, your perspective, and then how your journey came to land you here in this leadership position at Consejo.
Absolutely. I'm excited just to think about and being able to share about the journey that you're speaking of. I've been in the States since 2005, and all throughout these years, I've been working with Consejo, no one else but Consejo. And as far as it is good to point out that looking from a high schooler, someone who's going into about to embrace a trade or going into college or what have you, completing high school, the first thing that comes to mind is that some of us really come from some backgrounds, and even where that's necessarily mean that we have family with issues. I mean, there's always just that simple fact of growing up, going from this uh, kid into adolescent years, and then kind of getting to grow up and looking at been growing up more adulthood and embracing a career, what have you. I found myself in a place that I needed some help. I needed some help, and I always had the passion about social services, community social services, about communication, about psychology. But you know what? I never had the information made available to me to know they were at the point actually opportunities to get into that, right? Not just going after education, but actually opportunities to make a career out of what I liked, which again was being out in community, providing social services and finding resources for people and help people and so forth and so on. So through my own personal journey and need of services, uh, found out that that was there. That was there. I went after it. I went after it, and you know, now I don't know if it's evolving into something more acceptable, less stigma, or the need, or integrating, you know, services within the healthcare system. But behavioral health, social services, and substance use disorder treatment, mental health, any of the care coordination, system navigation, it's all coming together. So again, that's the one thing that when I found that out, it took what it took, but I went ahead and trust me, love the fact that I made it a career, and that's what I think I'm gonna be retiring of. So that I hope that helps, to get you to understand that at times when information or resources are not available, by the simple fact of connecting with someone and learning of a specific of certain career or opportunities really helpful. And when you really get into the mode, all right, I'm going after this. I'll tell you one thing. I do have to say that what made it really possible and really more attainable and realistic and real for me was the fact that mentoring and professional development were made part of the deal. They were included. All right, so how can I say no? Great, amazing people, whether it was within the educational institutions that I attended or people that I knew from the outside in the field, and embraced me and provided that for me. Here I am, 20 years later, still excited about it. I can spend all day I'm living. I hope what I just gave you as far as the journey helps. Yeah.
Yeah, I mean, I have a question. How did you find those mentors? Were you, was it people in your community? Was it people that you were connected to via your education? Which I also have a question a little bit about just what your educational pathway was like. But how did you find those mentors? And then, what was that relationship building experience like so that you really we're able to have a strong support system to help you through to where you are now?
So as I say though, right? So through getting help myself, right? Uh, Through the provider that I was getting help with, and already having myself shown and growing interest in social services, psychology, communication, that put together, kind of introduced me to this network of people that be Proctor College or Laney College down in California, or up here in the Pacific Northwest with the uh, Northwest Indian College, and so forth and so on, right? So it was put together right there between that providers and the network that I was introduced to, and with those in educational institutions, right, the schools there made it. Oh, it was perfect. It was a perfect thing. You asked me again. Uh, what you guys doing right now and providing this information and utilizing the stage and even this platform, the Zoom platform, uh, to educate and to inform students what's in there at that time, right? So it's really key. Again, you asked me how. It was just one thing through connecting with the provider and the provider learning of my interest and my already educational background, uh, so to speak. Uh, Immediately the connection was there. Immediately the connection was there. So yeah.
Great. I do have one more question just for you, as our interviewee here, and then I want to shift a little bit to kind of, jobs and occupations available throughout Consejo. But specifically to you, if you were to kind of, give a high schooler or give yourself, from when you were in high school, some words of wisdom about if they're interested in going into whether it be public health, whether it be more specific to very mental health, counseling, substance use disorder, professional, um, or if they're just interested in public service in general and they don't know what that looks like what would be your words of wisdom to pass on?
I want to tell you one thing. You, before I get to the students, and you and I know that a lot of values placed on the degrees and having a diploma from a certain institution, and and so on. But going to the student now, I would like to encourage you guys to be open-minded and don't allow what I just mentioned a moment ago. That the one thing about going to this particular college or university is like it means so much. Well, yes, it does. But guess what? At Trey, uh, technical colleges, uh, local colleges. I don't want to call them community college because that's not the case. I mean, yeah, we identify them as community college, but the one thing here is that I'm talking about those institutions, education institutions already providing, all right, some provisions. There are provisions there, and there are means and ways for you to start getting involved from that moment on, and start getting the education and start getting the involvement and participation and exposure to agencies, to certain practices. That's the one thing. Thanks for asking that. Within Consejo, we're not just talking about a particular license for mental health professional, a particular license for substance use disorder professional. In between those two, there's so many. And those that are helping out youth and young adults that are strong in community violence or have been negatively impacted criminal justice system, or those individuals that have suffered from domestic violence or sexual assault, or those individuals just plain simple in need of some guidance navigating the systems because barriers that be physical, that be language, that be legal, what have you. Uh, Getting to know what's offered with the local colleges and technical colleges and so forth is huge. You'll be surprised to hear the amount of individuals as myself started the journey there. Started the journey there, even after having attended college or having done something else, having to start the journey here is great. A lot of people go from there to higher educations. They pursue their bachelor's degree, their master's degree, and so forth and so on. But again, uh, never doubt those those educational institutions, such as the local colleges, will not provide thing because that's not it. That is a great start. And as I mentioned earlier, once you open up the door to the network of those opportunities, forget about the sky is the limit. That's what you want to embrace and make a career.
That's really great. I appreciate that insight in our career and technical colleges in this region where we are so lucky that they're so connected with our healthcare industry leaders, but healthcare spans so many different types of occupations, right? So when you go to a community technical college and you want to study communications, you can actually, you know, apply that to a healthcare lens. And I think it's definitely important to acknowledge the multiple roles and opportunities within an agency like Consejo. I mean, you have, yes, you have very like healthcare clinical practitioners, with like healthcare related degrees and certificates, medical assistants, care coordinators, you have mental health professionals with substance use disorder professional certificates. You have IT, right? Like there's such a broad range of ways to kind of contribute to an organization like Consejo and to contribute back to your community. I would, if you want to touch on that briefly, I definitely encourage you to, but definitely want to focus on the career career occupations and then development opportunities, specifically within the mental health, behavioral health occupations at Consejo, and kind of what that looks like from entry level, what that looks like as far as mobility and career progression, pathways, promotions from within, and if there are any sort of undergraduate opportunities for students while they're getting their degrees and credentials, so that they can be exposed to what working at an agency like Consejo would be.
Absolutely. So you mentioned entry level. And it, I guess so happened, not one, not two, not three, not four, not five, but many of my counterparts, those that are already up in management or administration, they came to Consejo level entry position. That'd be at the front desk receptionist, or that'd be as a case manager, that'd be as a domestic violence advocate, and so forth and so on. Nothing wrong, or a trainee, all right, for the substance use program, or intern, the mental health program. Uh, those went and did what they had to do, and within Consejo, and it is one thing that I love, and it's not just unique to Consejo. When I'm talking about these organizations and this the network agencies and I mean healthcare providers and so forth are made available to us at the entry level, it's huge. So once you get in there, you'll find out the what is you really your what is that you want to go after, what is that you want to go after, right? I don't want to get you all confused, or but here's the thing nowadays, there is no not uncommon thing to see providers getting dual license, right? And we kind of going with the merging of their profession or disorders and so forth. But before I get there, so she mentioned something important, because now with everything going electronic, that's another thing. I mean, and it just blows my mind because I think someone within the agency, she used to be a mental health therapist. Also had a degree on programming. She's a wizard. She has the clinical and the therapeutic, background here, all right? But she's also, when it comes down to electronic health records, data, and so forth, it's crazy. It's crazy. So you don't you don't get those mixed with the individual so often, right? But she's doing awesome. And you mentioned that. You're right. We going digital, electronic. That is another opportunity. And even what we're doing now, Zoom is a practice with the pandemic we've been doing for the past year, virtual and remote services. But I'm getting sidetracked. Getting back to this, so at entry level, either is nothing new for someone in my position that at one point was receiving services, was attracted to it from a school presentation and so forth, to end up knocking at the agency door and applying for an internship or just a volunteer position or entry level position is not uncommon, right? Not uncommon. But through that, once again, the important thing is the mentoring and the professional development made available. A matter of you consistent to it. For instance, let's talk about the substance use disorder professional trainee license. So the trainee license allows you to get your schooling, get the amount of substance use disorder related courses along with associate degree level education. Uh, you know that the Department of Health allows you to renew that particular license of trainee up to 4 times, right? It's good for 12 months, so you have up to 3 to 4 years to get your schooling done and get your practicum hours done. All right, that is important because while you get in those classes and get in the education, you go after the degree of just for the program. It could be either, right? You will get in, you will be getting those hours of the practical hours, and then by the time that you're done with the hours and with the educational requirements, you'll be allowed to take a national exam to become licensed a professional. And at that moment, that trainee is no longer there, right? You a substance use disorder professional. Consejo is one of those agencies that work with trainees and allows them to to earn their hours and so forth and so on. All right. Um, Education must be ongoing. You can't stop because that's the incentive. You want to develop and grow this profession and career. With this mental health is kind of similar. With the mental health, in order to obtain the same level of license, you will probably have to go after the bachelor's degree and the master's degree. Consejo also has already in place and from a couple of colleges and universities with undergrad students going after the degree come and do their internship. And that's another thing that do. The trainee for the substance use disorder and the intern for the mental health therapy. Those two incredibly once they finish their internship, they that's a good way to recruit people out of the school, right? So that works great. That works great. And that's what I was saying earlier too. Not only those that receive the services, but the students coming in get right now that there's growth and opportunity and mobility and promotions from within. And it's amazing to see that. My experience being that I've been with them for gosh, all these years since 2005, the number of people growing and developing in these positions that are whether they stay with Consejo or they go out to other agencies or this or what have you.
Well, I think that's great, Marcos. You really covered a kind of a broad range of, you know, both from what your journey was, how you got to where you are, as well as some of the opportunities within Consejo, you know, room for mobility and promotions within. You definitely talked kind of generally, but definitely, you know, a little bit about what the education could look like. You know, the example that you gave of one of your peers, who was really good at one thing, but was, you know, kind of did work on another thing. And then you found out she was really great at this one thing, and, you know, able to kind of, you know, tap into her natural skills. And that's kind of one of the big benefits of working for an agency like Consejo is, you know, using the entire, you know, the whole person. You know, you're caring for the whole person as a patient, but you're also trying to use the whole person as a staff member, and all of their strengths. And that's something that you guys do really, really well. So I think, you know, in our last few minutes here, I don't have any other targeted questions, but if you just wanted to say any last words, words of wisdom, before we signed off here, that would be open. So the floor is yours.
All I can say is we need you. You know, we need you. Community needs you. You are needed. Make a decision. Be part of this. As we weren't, you probably would not become Bill Gates by doing this and getting into this career. But it's really rewarding, and as you move up and into the development and getting those promotions, whatever, it makes it more. What can I say? As far as income, as far as that, it gets better. It gets better. The a lot of people really hesitate in getting into this field. They don't see it. They don't see it as sustainable. They don't see it as something that will uh, live off, or but it's not the case. Uh, that's all I have to say. Give yourself an opportunity to learn about the careers how much, and reach out to Consejo if you have some questions. It's no
How would
different.
students, how would students do that? How would they reach out to you, or Consejo in general?
So you can go to our website, and there are opportunities there. Whether it's just to, if you have some questions, so you just want to have interest in becoming an intern or a volunteer, the resources are made available to you at our website, consejocounseling.org, and there is an email address that you can actually use as well. But and again, and I'm not just recruiting for Consejo. I want to make that clear. That'd be Kaiser Permanente. That'd be Swedish. That'd be Seymour. That'd be I don't know. You name it. The need is there. The need is there, and the huge thing. And I'm sure HILT has been doing a great job at communicating this. We're not moving away from integration. We're not moving away from integration. The thought that primary care or uh, healthcare right here is just the only one need to be addressed. No. That's silly. Bringing the behavioral health and working on those social health, and as you mentioned earlier, seeing treating the person as a whole, right, in a holistic way. It's just we're not going backwards. Integration is here. So by getting yourself involved in this, I mean, the network that I was talking about back in my day, it's nothing compared to what we have now. It's nothing compared to what we have now. Yeah, that's what.
Yeah, I definitely don't think that, you know, primary care providers could do work that they do without behavioral health agencies such as Consejo, who, you know, work with very specific populations. So it's absolutely, you know, a wonderful organization to work for. But not just that, you know, the roles and the occupations that are highlighted within or Consejo and organizations like Consejo are needed now more than ever. Because yeah, I mean the Kaisers and the Swedish, they they need, talent, and they take care of people as well. But, the behavioral health agencies are kind of where the new care coordination is going to start, right?
Thank you for redirecting and rephrasing that. I wasn't, I'm not recruiting for them either. We need you.
Yeah.
Yeah.
No, I think we're all,
Yeah.
yeah, no, as patients and community members, it's going to be your local, community center and behavioral health agency. That's going to be where you get your primary care. And then when you need a big surgery or something bigger, you're going to have that taken care of, right? Because you're connected to your community, connected to your own mental and behavioral health, and then primary care can use their resources to do something else. So that's yet one of the many reasons why not just behavioral health, but Consejo, who works with specific populations, is so important.
And not only that, though, I forgot that one of the most important things, I did mention it throughout and early, about our Latino community and Latinx and Chicanas and so forth and so on. But the reality, when it comes down to this, be able to identify with those that are serving you and sound like them and understand their language and look like huge. It's huge. That's one thing that I didn't even mention, the struggle to find the adequate personnel to work with clients that are bilingual, that are bicultural, and so forth. It's like that need is huge, really. I needed that to happen. It's a reality. It's a reality. Yeah.
Well, thank you, Marcos, for your time. With that, we're going to end the interview. So thank you again
Awesome.
so much. You know how to get in touch with Consejo and Marcos via their website, and enjoy the rest of the event. Thank you.
Thank you.